Well, I've expanded it as well. We're getting there. Hello, everybody. So what is Grace Cares? Grace Cares is a CRC, so it's a not-for-profit organisation. So that means all the money that we make goes to helping people. So we've got different fund pots. So it's to help older people with grants and funds and kind of their families, and also care workers as well. And we host a community group. So we've got one at the moment. I've got 9 older people, and once a month they come to my house, or I've got volunteers as well. We put on an afternoon tea party for them, and that's kind of the first starting of the community groups in Lichfield that we're going to want to be doing. So very simply put, what do? Is care equipment. It's the sale of pre-loved care equipment to get these funds. So we want to stop items that are needlessly going into landfill. I would hate to think the amount of Zimmer frames that are being put into landfill right now, and make care equipment that's often quite expensive available for everybody at about a third of the cost, fully safe, risk assessed and everything, and then use that money to help care workers and older people across the UK. So instead of me yabbering on, I thought I'd show you a few videos. Here we go. Hello, I'm Hannah Montgomery and I'm a co-founder of Grace Cares. Why? For the last almost 2 decades I've worked in social care in some capacity. I came back to my hometown of Lichfield in 2016 and I set up a marketing company called Goldust Marketing, and at that same point I set up the Contact the Elderly Lichfield group, which helps over 75s, and when they're lonely and isolated, once a month we take them out to someone's house for an afternoon tea party. Fast forward to a couple of months ago, one of the old people that I help support fell down the stairs, and she lives in a masonette top floor flat. She has no family support and she has a limited income. I called one of my friends and co-founder, Adam, because he has a waste management company, and I said, Adam, if you find a stair lift that goes straight up and straight down, let me know, because we need to get Doreen out of her flat. To this, Adam said, I have loads of care equipment that often has to go in landfill because no charities will take it off me. It is a crying shame. So I went, I know people that will need this equipment, and this is the why of Grace Cares. So now fundamentally, we want to help care workers and older people, not just financially with grants and support, but also emotionally to help them, and also the needless landfill waste. Let's stop that too. So that was kind of where it came from. I wanted to get Doreen out of the flat, and there's got to be many more Doreens that haven't got a clue how to get money or how to help themselves, and they just, go home. Would you just, now I'm quite to the point with things, would you just die at home, because we don't want that on our figures. So we want to be able to help Doreens that don't have any money and what have you. So the next one is Adam, one of our co-founders' wives, which is quite interesting.
Hello, my name's Adam and I am a proud co-founder and member of the Grace Cares family. A little bit about myself. I've served 13 years in the Royal Air Force and I've deployed on operations overseas. In 2017, I decided to leave the armed forces and I'm now operating in the waste clearance industry. During this time, I've noticed a lot of care equipment going to waste and going to landfill. After a discussion with Hannah and Emma, we decided that we can change this and make care equipment accessible for all. I'm also a carer for my mother, along with my sisters, and she's been very unfortunate with her health. She's had brain aneurysms, she's had cancers, and she's also registered blind. So I fully empathise and understand that care equipment is not always accessible or affordable. So I'm on a passionate drive to try and change this and make care equipment accessible for all.
So there's Adam, that's the guy that I called wanting a stair lift for Doreen as soon as it had happened. And this is the final founder, Emma, who is just such a yummy person. You'll see that now.
Hello, I'm Emma, and I've been really blessed to have worked for myself for over 20 years now. After being successfully treated for cancer, I realised I needed to make some changes in my life. I've always really enjoyed helping other people. So when the idea for Grace Cares came about, I knew that it was something I wanted to get involved with and work with the brilliant Adam and Hannah. The idea for Grace Cares is really simple. We want to stop items that are needlessly going into landfill, make sure they are reused for people, sell them at an affordable price to people who need them, and use those profits to help our amazing care workers who do a brilliant job helping our families. And we also want to help people in need who need our support the most. For me, I am particularly excited about our vision for the future to open a community space where you will always receive a warm welcome, hot food and someone to talk to. I'm really excited about getting involved and getting it started. If you've got any questions, please give us a call and get involved.
So there you go. So that gives you kind of an overview. We officially launched on Valentine's Day because care is at the heart of everything we do. I am a marketeer by trade and I am particularly cheesy. So that's why we did that. So already we had donations of wheelchairs from the Commonwealth Games. So often with huge events like that, they have to have a certain amount of wheelchairs and accessibility stuff and evacu chairs to be able to hold the conferences or the events. What do they do when they're going back? They just have all of these chairs that really haven't been used. So they were really quite good fun. That was great. We started speaking with the NHS Birmingham Community Trust. Now we are registered on their help desk. So when they have equipment that they no longer need, and it's in the list of equipment that we've agreed that we will pick up, we will pick it up within 5 days service level agreement and take it away. And then I report back to Sam where that equipment has gone, how much carbon it's saved, and what have you. So it helps with their figures for delivering the NHS, delivering net zero kind of strategy stuff. We've now got a depot in Lichfield. So we've already realised we need 2 chairs because when people are picking up the equipment, it's an emotional thing. So we almost see that as a care visit. So whenever we go and drop it off or people come and pick up from us or come and do deliveries, we also factor in 30 minutes because we almost see it like it is a care visit because these people are like, my husband, this has happened to, and I'm like, sit down, get in one of those chairs. And that's kind of, we've got that flexibility to be able to do that. Now so it was Contact the Elderly Lichfield that I set up about 6 or 7 years ago when I first moved back to Lichfield. So now it's our first Grace Cares group that we're running with the afternoon tea parties. We're now working with Barchester. So we've got an event that's happening in June, the last week of June, over Care Home Open Week to raise funds and awareness of what it is we're doing. And we're starting a really interesting, as I said about Zimmer frames, one, they're really hard to store. So I know why the NHS aren't doing it. Who knew that Zimmer frames for your larger person, your skinnier person, your taller? Me being completely naive, just thought there's ones with wheels, there's ones without. No, and they're really hard to store and stack. So we're working with the local colleges and schools. We've got South Staffordshire College, we've got King Edward's School, we've got Lando Forte, we've got Chase Terrace Academy. So I'm recruiting them at the moment, and it's either their design tech students, their young enterprise scheme students, or their art students that will have a brief for Pimp My Ride. So they'll all be given a Zimmer frame in order to change it within certain parameters. They can either pimp it up, let's get some biodegradable glitter on there and make it so a piece of care equipment doesn't have to be so hideous. Let's be honest. Hello, I've got something wrong with me and I'm also using a hideous bit of kit. What is the need for that? I was speaking to a head nurse and she was so sick of them, and her husband's quite ingenious. She'd made one into a barbecue. So he'd kind of like soldered off and made this barbecue out of, and it had the wheels then. And she said, oh, it's much easier to move. And we're then doing an exhibition at our local St Mary's hub. So there's students from a local special needs schools that will be judging them because they use care equipment, and the people that come along to my older tea parties in the local community, they'll be judging as well. But we kind of wanted to push it to a national level because finding from opening the doors in February, we are getting donated a week. We're getting at least 50 Zimmers donated. So our storage costs are astronomical for them. You know, an occupational therapist is probably going to go, Doreen, you need one upstairs and one downstairs because you don't want to be carrying, which is fine. But there's got to be, one of my things is I've got to sort that out. So that's kind of gone into a side direction, but that's what we're going to be doing as well. So what could you do to help us? So buy our pre-loved care equipment. It goes through, we can either get an infection control certification done on it, a murder scene clean certification done on it if it was going into a care setting, for instance. We have an astronomical amount of insurances and we have maintenance guides that we have to go through, risk assessments and quality assessments. So this piece of equipment will be perfect for use. So buy our pre-loved care equipment, volunteers, skill sets, ideas, any ideas that come into your head. Oh, that'd be really useful for Grace Cares to know about. Please tell me. I don't know everything. I want to absorb everything that you know. Donating old care equipment for within 25 miles of Lichfield, we will come and pick that up for free, because we're trying to understand the most sustainable way of doing it. We're looking at funding at the moment for a hybrid vehicle in order to do that. And we're also talking to supermarket chains for when they go and deliver food, if they can be picking up care equipment and sticking it in their storage for us, how we could be working with the wider community to hit sustainability goals, financial contribution, paying it forward, considering a corporate partnership, working together, following our social media, or enrolling onto our newsletters, which is on the website, or just letting people know. Spreading the word would be really useful. I understand I've gone blah at you. If anybody has any anecdotes or questions or things they want to share with me at this point, that would be wonderful.
I think it's incredible what you're doing, Hannah, now. So for people who don't know myself, I'm an ex-registered manager, used to manage a care home, and I mean, the garden was wonderful. We had planters, we had chicken coops, and we always had a train of Zimmer frames. We always had just Zimmer frames stacked up, one after the other, one after the other, one after the other, because we couldn't get rid of them. We didn't know where to send them. We didn't know what to do with them. So how can the sort of average care home get involved? Can they just phone you? Can they just get in touch and say, we've got all of this that needs picking up?
Yeah, and if it's within 25 miles, we can get it. Because Adam owns a clearance company, sometimes he has to go out of area. So if you're able to keep onto it for a while, then we can come and get it. But Barchester, because we're saving them the money for skips, are keeping it in a separate storage unit, pack testing the items for us as well, and then delivering them to us when we've got. So, I mean, that's a Barchester, isn't it? So that's a completely different kettle of fish. But we'll find a way. We will find a way, and then we're hoping once we've got the model completely nailed down, somebody else we can go to the local authorities and go, do you want to invest in somebody running their own Grace Cares? That's cool. We can give you all of the processes, procedures, and all of the learning things that we've learned, and let's have a hub there and a hub there to stop the travel side. So yeah, just call us, contact us, anything.
I mean, that's fantastic. And as part of the Institute, we've got 9 care associations and 4 local authorities who are partnered with us as our care hubs. Now, I don't want to automatically just go to them and go, oh, by the way, did you know this exists? And you'd be inundated with a national supply of equipment. But what's the sort of scope for us to be able to do something like that? And when we're contacting people and talking to people about it, how big do you want to go straight away?
Definitely. So I've spoken with Staffordshire Care Association, Julie over there, and Kieran over at the West Midlands Care Association. So they're kind of pushing it out. Spoke with Professor Martin Green. He's let Care England members know within 25 miles of Lichfield, but it's trying to get that model working correctly here until we can do it. And it's them raising the funds at the moment. I've put in a chunk of money, Adam's put in a chunk of money, and so is Emma. That man there on the screen, that's my dad. He used to be a paramedic. He actually had a mental breakdown during lockdown, and during that's why the mental health fund is there. But now it's a little job for Johnny because he knows all the equipment and he's fabulous. You know, we've got Sue that goes out into the local community and tells everything. And we've got Lawrence, who's Emma's dad, who's a retired builder, who helps us with quite a lot of tinkering and maintenance of things. So anybody that wants to help with giving us a skill or helping with an idea or anything, as well as equipment, would be wonderful. And also the CQC don't mandate that you can't have used care equipment. So maybe it would be the purchase of, we've got some scale chairs. There's £1,000 worth from the NHS given to us. The foot on it needed a screw on it. We rescrewed it. We did the whole maintenance thing. We work with Jo at HCS UK because they've got a whole maintenance division. So she helps us on stuff that we can't fully maintain ourselves. So that was sold on for £350. The care home got an absolute bargain. We got some money into the coffers, into the fund. So everyone's a winner, really. So even purchasing stuff would be fab as well as giving, because there's not enough storage in most care homes either. So it's almost like you're almost renting it back to us and then us giving it you because we're having the storage. But yeah, it'll all come out in the wash of it at the end. But we've this was actually from the people plan. The companies that actually pursued sustainability properly and adding value, not just greenwashing it, had higher profits, both in medium and longer term, than those that didn't pursue it, which I think is complete food for thought for people going, that's going to be too expensive, or I've got to think about it. I've also written a proposal as a how and why proposal for care providers as to how to use Grace Cares. I've also written information on how you can kind of add into your business sustainability and business continuity plans by using Grace Cares or similar end plans. Also within that is the case study with what we're doing with the NHS Birmingham Community Trust, so you can see how that's working. That you might just take ideas from that. I've also, if you scan that code as well, you can get the people plan, because there is a huge chunk of it on greener care, so I thought I'll add that into the links, or if you just wanted to have a conversation. So if anyone wants to scan that QR code or get in touch with me and have all of that information that I've pulled together, that's cool with me. And yeah, just compound effect, I suppose, like what Elaine said, in terms of just be the change you want to see.
Yeah, definitely. Now, Andrea, I've seen you in the chat. Andrea's from Hampshire Care Association. Do you want to come in quickly, Andrea?
Oh, hiya. Yeah.
Hey, Andrea.
Hi, Hannah. We've talked before, haven't we? Yeah, this is just so fabulous, and thank you again for your amazing work. As I said, yeah, I would love to basically, that your talk there of a hub model, or I don't know what you want to call it, franchise, I don't know what it would be fabulous, because here in Hampshire it would be just lovely to set something similar up here, and I don't know how we would go about that, or what the next steps would be, but as you said there, Adam, it'd be good to get potentially the local authority involved. I think, as you say, it often actually saves money as well as being the right thing to do, so everyone's a winner really with your fabulous idea. I just wonder how we can spread it further than Lichfield, basically.
Yeah, me too. I think it's kind of giving us the first year of putting all the proper processes in place, because now even from taking on a piece of equipment, so somebody may give me a piece of equipment, but it may actually belong to the NHS, so we have to go through a process that people have to sign off where they've got it from, if it's private, if it's NHS. Then if there are any identifiable things on it that say that it is the NHS, I then get in contact with, if it says Sandwell NHS, I'll get in contact with them and say, I've got this, would you like it, and what have you. So it's making sure that all those processes are completely ready, in place, and all the pitfalls we've had are done, and then we could go to local authorities almost
with a kind of model to replicate kind of thing.
Here is how you would do it. You could either, and this is how much it cost us to put this all in place, so you're going to need about this amount of money, but actually what we're doing with reporting back to the NHS on what we're saving in terms of carbon, and we've started this, well, it hasn't published yet, but showing like wheelchairs going past a landfill and into someone's house, and showing month on month how much stuff is, one, you're not using the carbon to produce the metals to produce those things, so what you're saving from that, and what you're saving from it going into landfill and different things like that. So once we've got all of that as almost as a case study, that'll show the costs as well, because at the moment we wouldn't be here if we didn't know it's the right thing to be doing, right? But there's some people that need the money and the facts.
Yeah, that's it, isn't it? Sometimes it does come down to that, especially with cash-strapped councils and things. Yeah. Okay. Well, that sounds really positive. Potentially, once you've done all the hard work,
yeah, I know, right? But
you can then tell others how to replicate. And so, yeah, it'd be fabulous to talk again. Thank you.
Yeah, no worries. Thanks for your help so far, to be honest.
Thank you, Andrea. And yeah, just talking about the money, that was the one response we always used to get back from our NHS suppliers, was it costs us too much to come and pick them up, repurpose them, and then send them back out. So it's easier just to prescribe new equipment, which I always found really shocking. And I still couldn't figure out in my head how that would work, when actually, if we take into account the cost on the environment, surely it wouldn't be as much as picking up and collecting. And I'm wondering whether there's scope for your future in Grace Cares around working with OT teams to actually repurpose them on site as well, for care homes, and saying, look, this is what we've got available, and providing sizing guides so we know what our equipment's good for, the sizes and the people who are able to use them, and actually getting OT teams trained up to re-prescribe them on site. So actually this one would fit and suit you, we've measured it up, why don't you use the one that's already on site as well? I think you've got huge scope with Grace Cares, and it's going to be incredible to see where you go with it.
Well, I think that the Pimp My Ride kind of thought process was then to almost get it launched nationally as this is a problem, and look at the obviously not sustainable ways of being able to repurpose them, but look, you can have a little bit of fun with it, and to highlight it more at a national level. But definitely the OT teams need to, and once I've kind of got that, then, but that's a really good point about the sizing guides. Also, what we're thinking about doing longer term. Now, I definitely need to work on a better name for this, but you know how the AA have people on just on call, and then you get called out, almost like a death squad, in terms of, I've had so many horror stories about people that have called Mediquip and have called the NHS and have called people going, my dad has died in this bed in the living room because he wanted to be there. My mum is now living there and it's been 2 weeks and no one's come to pick it up, and she can't even go in her own living room because there's the bed where my dad died, and I'm just going to cut it up with a knife and attack it because whatever. Surely with that amount of, there should be like an AA-esque response team to even stuff like that, the emotional, mental stuff. So it's looking at that side of things as well, how logistically stop stuff like that, as well as the waste of the items, because they don't always go and pick them up, and they're just left, and then they get skipped because people get fed up.
Yeah, definitely. That sort of after bereavement service, I think, would be like a huge point for people, especially like you say, care at home. It can become burdensome. My nan died just before Christmas, and we were left with all of that stuff there. Now, fortunately, Grandad had a nice big garage, so we just took everything apart and moved it, because it was going to take weeks to come and collect it. But not everyone has that opportunity. Not everyone has that option to do so. Do we have any more questions for the fabulous Hannah? Hannah, have you got anything more that you would like to share with us before we take a quick sort of 10-minute recess, grab a brew?
No, just scan the QR code or find me on LinkedIn or what have you. And if anyone wants any of the free information that I've put together that might be beneficial to you, then crack right on.